I hope everyone can hear me reasonably well. So I've been asked to talk about how to win friends and influence policy. So I haven't been asked to give this sort of talk before, so I blame probably Marina for this one. But so when I'm thinking about what I would do in 15 minutes is maybe rather than have a sort of systematic review of how to influence policy, make it a personal trip for me. So one of the things that I've been able to do in my career has been to influence policymakers at various levels. And so I was going to just take a trip down memory lane for me and cover some of the things I've learned and what works and what doesn't work, and how I've developed skills to influence policymakers and try and get evidence-based policies in place in the area of mental health, which is the area that I work in. And for that, I think it's important to realise that I come from a certain perspective in this area of influencing policy. So I, as Cara said, I trained as a medical practitioner and as a psychiatrist. So I started out life as a clinician, and so I came at policy from a clinical perspective rather than from another perspective, which might be a primary research perspective or from another area of government or another area of health or a non-health area. So I'm just going to take you through a 15-minute trip down for me, which is going to be memory lane in a sense, but it'll give you a perspective of the different ways in which you can influence policy, and there are multiple ways to do that. So I'm going to cover the sort of 5 areas that I mainly touch on around my clinical practice, whether research evidence influences policy or not, and if so, how does that happen? The people we try and influence using, in this case, government policymakers, is the people we're trying to influence and trying to understand their perspective, because they're the recipients of the influence you're trying to bring. Understanding the role of advocacy and the role of opportunity cost, and windows of opportunity which open and close to influence policy. So I started life in the trenches, so to speak. So the role of people who've worked as clinicians or as providers of care for consumers or populations of people have a certain kudos that policymakers accept almost without any disagreement. They believe that their perspective doesn't encompass usually the role of providing healthcare directly to healthcare users. And so you come with already an arm of knowledge and experience and credentials which make your position strong from the outset. Some of the biggest lobby groups, of course, in health are groups of providers, the Australian Medical Association, various specialist groups, and they come with an unassailable position often when they're influencing policymakers, but they also come with a great deal of baggage, and the baggage is around the fact that health services aren't there for the providers, they're there for the patients or the consumers or the population. And so there's all recognition of the skills and knowledge and perspectives, and there's suspicion about the agendas which providers might bring. And it's important to not come across as a lobbyist in this sense, not come across as trying to deliver policy advice, which is more about those providing the services or providing the programs than it is about the recipients of the programs. The strength of influencing policymakers, if you come from the coalface, is your understanding of what is needed to make outcomes better, to prevent disease, to manage people's access to healthcare, to improve their outcomes. And that, if you take that perspective in your speaking to policymakers, you're likely to have much more impactful outcomes. If you're able to provide some better outcome for the professional group you belong in, then that's a secondary benefit. But if you put that up front, you're liable to have some of the other information and some of the other advice you give devalued. So as Cara said, I went from my time as a clinician to train in research, and I was fortunate enough to have the scholarship to go to Stanford. And I learnt the power of research and publications and influencing policy. It is when you live in research as you are doing and as we all do, and we know the limits of data, we know the limits of statistical analysis, we know the limits of published papers. It's a general rule that if something is in a peer-reviewed journal, a policymaker would largely assume that that's correct. And you can do a report for government, and you can take that report that you do for government in policy and you can put it in a peer-reviewed journal, and suddenly it has a degree of magic that it didn't have as a report to government. There's something about the peer review process which is perceived from the outside to be more robust than we might perceive it if we're trying to get publications through the peer review. And so if you do work on reports for government or for policymakers, always try to get that in the peer-reviewed literature. One, it's searchable. Two, it's suddenly assumed an extra layer of importance that it didn't have before. But also you understand the limitations of research. When I was at Stanford, I did every week for a year, for 1 hour a week a year, we met with a woman called Helena Kramer, who's the leading statistician in mental health in the US. And we only looked at papers from the New England Journal of Medicine, which is the #1 ranked clinical journal in the world in impact factor and rankings. And we only looked at the methods section. I used to, as a doctor, only read the results in the abstract. We only looked at the methods. And this was a long time ago now, but 50% of those publications, the methods failed to deliver sustained results which could be really depended upon. And Helena Kramer took great joy in dismantling the methods section of these papers. And I learned a lot just doing that 1 hour a week for a year. So you know the limitations of the research as well, and you can point that out to policymakers if they've been given a piece of research which in fact falls short. When I came back from Stanford, I went to the Queensland Mental Health branch and became the Queensland Mental Health Director, and we learnt about what it was to be on the other side of trying to be influenced. So I was the recipient there of research and people wanting projects funded and programs funded. And the time frame that decision makers work in, the amount of evidence they need to make decisions, the ability to decide what they can accept and what they won't accept, is a completely different world to what researchers live in. I have spent and have unfortunately spent millions and millions of dollars of taxpayers' money on the run because it had to be done. There was no time to do a trial, no time to do a systematic review. The timeframes are often impossible, and it's uncomfortable as it is. Those decision makers don't worry about confidence intervals. They don't worry about uncertainty. They certainly don't need the methods explained in detail. They need to be confident that you're giving them data that you've put through the grill. And if they trust you and believe that you are doing that honestly and fairly, then you are very influential. If you take them through all the nuances, well, it's only sort of like the confidence intervals that speak, and you could go that way or this way, or it could be that, and we didn't include this. And, you know, we need to qualify the results by that. It drives them crazy. They've got to make a decision. They've got to make a decision based on what you can say, and you have to almost, inverted commas, dumb down some of your research so that it's consumable in the time frame they've got. They never read the Lancet. If they read the Medical Journal of Australia, they read the abstract. And so you have to work in that world if you want to influence those decisions. I then went to the federal government, and I learned this in Queensland, but I really learned it in the federal government, which is further away from health than the state government, is that we think of political decisions often as completely irrational and completely non-scientific, but politics is rational. There are reasons why those decisions get made. They may not be the scientifically robust decisions. They may be decisions around political expediency, because there's a political lens over all of governments. And despite what you might think or they might say to you, political decision makers, especially at the ministerial level, the primary aim is to get elected at the next election. And they can do a lot of good along the way, which most of them do. Most of them are there to try and improve things. Then that's an added bonus. But everything gets put through a political lens. And there are examples of 3 cost-effectiveness trials we put up to a minister when I was in government. One was an anti-smoking campaign, one was cervical screening for cervical cancer, and one was increasing the frequency of mammography. And the best cost-effective outcome was to stop this is a female project, so it's to stop teenage girls from smoking. That had the best outcome in a cost-effectiveness sense in reducing disability and premature death. The program that got funded was the mammography program. And the reason for that was that Kylie Minogue had breast cancer that year. And politically, that was the thing to do. And that got a lot of positive publicity for the minister, the government of the day, and it was a really big success from a political point of view, but it wasn't the most cost-effective intervention. And that can be frustrating, but that lens gets run over everything, and that's rational from their perspective, even though it may not be rational from others. From there, I went to the World Bank in Washington, DC, where I involved in setting up the lending program for mental, neurological and substance use disorders for the developing countries that the World Bank lends to. It's the largest lender for health in the developing world. It was then. So the issue there was, how on earth could you get mental health lend into loan programs when in fact the part of the aim was to make it a loan, so it had to be repaid with the economic growth of a country after the IMF had ticked off the macroeconomic framework. That was a challenge because I'd usually managed to get funding for mental health by going to the government and pleading how badly off mental health was. But if you went to Africa, a lot of things were badly off. And why would you spend money on mental health if you could spend it on malaria or HIV or whatever disease? And my supervisor at the bank, who was an economist, said to me, while you've been talking to me, Harvey, 125 people in Africa have died of starvation. Why aren't we just buying food? And of course, I thought, why aren't we just buying food? So I had to go and think about what was the opportunity cost. So the opportunity cost is the benefit from what else you could have spent that money on. And so the cost wasn't actually the dollar cost of running that program. The dollar cost for the policymaker was what the foregone cost of what else they could have spent that money on. And so you had to think in that world. So what was the return on that investment? How would it make the population healthier? What was the benefits compared to, mosquito nets or better sanitation or stop smoking campaigns? And that's the world that I lived in for 3 years. And that was quite challenging for me because I didn't have some of the data that we now have around the economics of the investment and the productivity and gains, and the fact that mental disorders, neurological disorders, substance use affect younger populations. So I'm understanding what else the policymaker could do with that money that you're asking them to spend on your program helps you understand the environment in which the policymaker is thinking, because they've got choices. And even within health, when it goes to cabinet, they've got choices between, should this go into education? Should we be building better housing? Should we be building better roads? Should this go to the Defence Department to buy another submarine? All of those things are on the table where the health minister has to take the budget. So understanding that environment helps you understand the world that those people live in. And the last slide is about opportunities. As Cara said, things come along just out of the blue. I don't even know where I was in 2018. I got this call to say, Productivity Commission's been given a brief to do a mental health review. We're looking for a mental health person to go and help them. Are you interested? And I really could not fit this job in. I was too busy. Anyway, I went away and thought about it, and opportunities come and go, and windows open and they close. There are times when you can influence and there are times when you can't. And when those windows open, they don't stay open for very long, and you've got to go, and you've got to go hard. And if you say no, you might live to regret it. So I said yes, and the report was released by the Prime Minister, I think, a week and a half ago now. It's a 1,300-page monstrosity that we hope will make a difference and move us a little bit further forward in improving mental health services in Australia and making life better for people who may have or already have a mental health problem. So when you get those opportunities, you often have never planned for them. The job to go to the World Bank, I never planned to go there. That just came out of the blue. I never had left Australia and never worked overseas before I went there. The job to go to Canberra from Queensland, I never applied for. I was called, said, you know, this is happening. Would you want to come for a job interview? Other times you have to actively seek a job and go hard for it because you can see that that's an ideal opportunity. So if you get a chance to influence decisions, to get behind the machine that drives those decisions and to understand how it works, because it is rational, it's not irrational, then take that opportunity, because you'll learn things influencing policymakers that you won't otherwise learn from reading it in a book or being the best researcher you can possibly be. Don't be intimidated. You probably know more about your topic than the policymaker you're talking to. Be respectful. Don't be afraid to dumb it down. Forget about the confidence intervals and the uncertainty, and be passionate and be dispassionate when it comes to what their goals are. And their goals aren't to make your life better or to make professionals or to provide more money for research. They've usually got a goal around what's going to get them elected, what's going to look good to the public, what's going to make a difference out there for consumers and for the Australian public. That's their lens, because they're the voters. And if you can get on that lens and provide them with the tools to do their job better, you'll become a favourite person in influencing policymakers. So thank you, Cara.